Hey everyone, it's Josh at Prescription Fitness, Physical Therapy, and Sports Care. I'm here tonight just to talk about the hip joint real quick. One of the most common things in arthritic hip joint. How do we know if we have an arthritic hip joint? What are the signs and symptoms? So if we look at the hip itself, here's a little quick model here for us. And what we're looking at is here's a half of the pelvis. And in the back, we sort of have the lower part of our spine, which is the sacrum. The sacrum wedges between the two sides of our pelvis. And then we actually have the hip joint itself. And you can see that the hip joint kind of comes up and in. So it kind of sticks here. So a lot of times when people come in, I ask them, okay, point to where you think your hip is. And people will kind of point outside, like my hip joint's here. Reality, the hip joint's a little bit more to the center. So it's actually in between, the line between this little bone on the side of your pelvis and then into your groin and kind of right in the middle, that natural crease in our leg. That's actually where the ball is. So one of the first things we notice that when people come in with complaints of hip joint pain, they complain of inguinal pain. Inguinal pain, again, being this pain right in the middle of the crease, between your trunk and your thigh. You certainly can have outside leg pain. So there's what we call a C sign, because the patient that comes in, they grab a hold of their hip on the side and they go, it hurts here. So it looks like a C, you get it? So C sign. And then the other thing that oftentimes is missed is that patients will come in and they'll complain of deep buttock pain. And we differentiate that by, is it something you can palpate? So you can put a finger on it and poke it, or is it feel deep? And someone with an osteoarthritic hip, they're going to go, that feels deep. Now, one of the things also look for is that the nerve root that supplies the hip joint is the femoral nerve. And the femoral nerve actually, the distribution of the nerve actually comes down the front of our thigh. So sometimes people even present with anterior knee pain or front of the knee pain, which really is coming from the hip. So it takes careful examination, detailed history, sort of tease this out and decide, okay, do I really have a knee problem, or do I really have a hip problem? Or it could even be a lumbar spine problem that's mimicking a hip problem or a knee problem. So again, human body is pretty convoluted in how it's put together. It's a great design, but we got to be careful in how we tease this out. So if someone comes along and they poke on the side of your hip and you go, oh, it hurts to the touch, well, guess what? Everyone hurts on the side of the hip. If you poke on the side of your hip right now and put your finger in it, you're going to go, that hurts. So does everyone have trochanteric bursitis? I don't know. In my opinion, I've never really seen a trochanteric bursitis. I think there's all sorts of other things that can irritate. You can see how bony, the outside of the hip joint is. There's lots of muscles that attach to this area. So certainly you can have irritation of the burst in that area, but it's sort of the low-hanging fruit to just quick and dirty just poke on someone and go, oh, there's your problem because I poked on it and it's sore and you have a trochanteric bursitis and let's give you a shot. It's up to us as physical therapists to really sort of give you a good clinical examination, and we all should be doing this, not just physical therapists, but all practitioners should do this. We're limited by time constraints nowadays, so I think physical therapists, again, this is what we do this best. We can help to differentiate what do we think the problem is. Is it the hip joint? Is an osteoarthritic hip? The joint itself will tell us a lot of information by how it moves or how it doesn't move, the location of the pain, the limitations that you may complain about. And again, going through a really long, extensive list of questioning can help give us a lot of insight into what we think the problem is. So if you're starting to have pain in the inguinal region right in the front, remember that's where the ball and socket is. So, danger. It could be some other stuff, but hip arthritis, certainly if you're in your 50s and 60s, we start to go, maybe that's what's going on. So there's you go. There's your quick little hip joint anatomy and osteoarthritis 101 in a brief 4-minute video. So we certainly can go more into depth on items and topics that people would like. If you're interested in something, just send me an email to our website at Facebook, prescriptionfitnesspt.com. All right.